Any
supposed to be
treatment.
for any treatment. Correct.
But every doctor does this.
They're supposed to.
It's
Absolutely.
required by law.
It is required.
So
Yes.
all of a sudden you have every doctor participating in this vaccine program effectively.
Right.
And this is the one treatment that doesn't require informed consent. And you're the only one who notices this? I mean, what?
I'm not the only one that noticed it. There were a lot of people that
No,
did
I
notice
know,
it.
but
but no, I get it. But you know what? This is the problem with vaccines. Okay. You don't get informed consent even with any vaccine.
Hold up. Did I just hear that right? Doctors are out here giving newborns vaccines on day one. Nobody asks for informed consent. That's not just medicine. That's a power grab. And wait until you hear how they justify it. This isn't just about health. It's about control, money, and laws that protect Big Pharma from any accountability. And guess what? Reagan himself admitted he regretted signing one of those laws. Yeah, it gets that wild. If you enjoyed our take on this, hit like and subscribe for more. These doctors aren't clueless. They're complicit. You don't accidentally line up millions of babies for shots they don't need. You do it because the system rewards you for it. Money, protection, zero accountability. And here's the kicker. Even the follow-up studies were 4 days, 5 days at most. That's not science, that's theater. But here's where it gets wild. They compare vaccine liability protection to food. You can't live without food. Nobody's ever been born with a vaccine deficiency. Yet food doesn't get liability protection. Only Big Pharma does. Think about how insane that is.
You go in and talk to your doctor about the DPT vaccine, or you go in and talk to him about the Hep B vaccine. But now, by the way, I talked to you about before Hep B vaccine. Okay, it was given to me when I was, 20 years old, 24 years old when I started medical school. Okay, because I was an at-risk person. You know when it's given now? Day one of birth. Okay, day one of birth.
you were an at-risk person because you were dealing with body fluids as a physician.
Correct.
Right. And you can
Okay.
be infected. But why? But now, in the 35 years since, it's required for every child born in the United States.
Yes, they get one on day one of birth, they get another one a month later, and they get another one 6 months later. And that's because it's a captive audience. That's the only reason. How many babies are going to be IV drug abusers or go out have unprotected sex? Or get a blood transfusion from somebody who's infected? And by the way, some of the pediatricians will tell you, well, mom could have had hepatitis B, and therefore you're trying to prevent the baby from getting it. Well, mom was tested for hepatitis during her pregnancy, so you would have known if they had hepatitis and hepatitis B, and so then you would have been able to either treat it or do something about it, or maybe prophylax the baby.
Why
at
would
that point.
pediatricians go along with that?
To put it bluntly, money.
Why are they allowed to practice medicine with those attitudes?
Um,
No, I'm serious. Why doesn't the FBI raid their offices? If they're giving infants treatment that the infant doesn't need that has potentially harmful consequences, and they're doing it for money, then they're criminals.
You're absolutely right. And not only are they doing it for money, but they don't even know what it is that they're doing. Do you know there's 2 hepatitis B vaccines that are in the United States right now, okay, that are in use? Do you know what the long-term, the follow-up study on those 2 hepatitis B vaccines is?
No.
4 days for one, 5 days for the other. 4-day follow-up on one, 5-day follow-up on
Where's the longitudinal study?
They haven't done it.
How can that be?
That's the vaccine industry. In 1986, when they got liability, okay, starting in about 1980.
Liability protection.
Liability protection, correct. Sorry. When they got full liability protection, okay.
The one that you don't have and that I don't have, but only Albert Bourla has.
Nobody else that I know of has this right now.
In the world.
In the world, in any industry, okay? Nobody. But the pharmaceutical companies do on all vaccines.
Because it's life-saving, but you can live without vaccines. You can't live without food.
I've never known of a baby that was born with a vaccine deficiency, okay?
Right. But
Right,
I'm just saying,
so-
why don't the food, one of the big ag companies, why doesn't your family farm have full liability protection? Because, talk about a life-saving industry.
Right.
But they don't have it.
No.
Only the vaccine makers have it.
Correct.
Right. Okay.
And Ronald Reagan, I think there's a quote saying that it was probably one of the one laws that he signed that he regretted signing. For what it's worth.
It wasn't a great second term, I would say. But
It was not.
No. Yeah. Anyway, I don't want to be mean. I like Ronald Reagan, I guess, but
No, I do too. I'm not, again,
yeah, but I mean,
nobody's perfect.
What is
So,
that?
right.
What is that? A lot of these laws were signed by Republican presidents,
Yes.
unfortunately.
The PrEP Act was signed by
It does make
George
you
Bush.
want another party, actually. Whatever. But that's not the scope of this interview, doctor. Okay, so there's no informed consent for any vaccine given, is your point.
So correct, because there are no long-term studies on any vaccines, and there are actually no placebo-controlled studies on any current vaccines that are on the market right now.
Boom. There it is. You've been told your whole life that vaccines are rigorously tested, gold standard science, peer-reviewed, and yet not one placebo study? That's not rigorous, that's reckless. And here's the hypocrisy. We demand placebo testing for new drugs, supplements, even skincare. But vaccines, they get a free pass. Why? Because they've been politicalized, weaponized, and shielded. The science doesn't apply to them. The rules don't apply to them. This is where the whole argument flips. Because when you realize it's not just about medicine, but about power, you see why even presidents regretted signing these laws. They unleashed a monster that can't be checked. And families, kids, newborns, they're the ones paying the price. So let's stop pretending this isn't about informed consent, because there is none. This isn't about health, because the data doesn't exist. This is about an industry that's untouchable, unaccountable, and fueled by laws that should have never been signed. They call it science. We call it a racket. And the sooner people wake up to that, the better.
Come on.
Not one current vaccine that is on the children's schedule has ever been studied against a placebo.